Hello, welcome to yet another episode from the Untold. Today, it's very, very, very ultra special.
Yes.
First of all, of course, you have Ahmed Hassan. You're used to this by now. Today is about, we can say medicine,
Yeah.
but also it's about cancer
Yes,
survival.
A survivor that we're going to have on the show, a
Yeah.
dermatologist, a doctor,
Absolutely.
an innovator in her own rights. But her story is special. Her struggles.
Yeah.
How she almost diagnosed herself, trying to find out what's
Yeah,
wrong.
100%.
And just taking us through her journey with cancer, her journey as a dermatologist.
That's gotta be beautiful.
It's going to be a beautiful story. Lots of things to learn from her.
Absolutely, very insightful.
And let's not waste any time and
Let's
start
do
the
it.
show right after this. We're back on the show being joined by our very special guest, Dr. Manal Sheta, a dermatologist and skin and laser consultant, correct?
Yeah.
Welcome on the show.
Yeah, thank you so much.
It's such a pleasure, honestly. Have we had dermatologists before?
Dermatology, one time.
We have, yeah?
We did one time.
It's a pleasure to have you on board. I
It's
think
my pleasure.
I'm
Thank
sure
you.
you have a long, beautiful story to tell.
Yeah.
Yeah.
I
Yes,
can't wait.
true. It's beautiful. Really.
I'm sure at the end we're going to realize it's actually a very optimistic start. And we didn't mention that you're also a cancer survivor.
You
Yes.
are also, yeah.
So that's definitely a lot of ground to cover.
Yes.
Where do we begin?
Well, I guess we want to begin with your story and how you entered the world of dermatology.
Yeah, actually, it's a family tendency in the beginning,
Okay.
but later on, I like my career and I love to be a doctor first as a GP and then as a dermatologist as a specific specialization for me. I love it now, but it was in the first position. It was in the family because most of the family are doctors.
Okay.
It was a tendency
Oh,
in
wow.
the family. Yeah.
So it runs in the DNA. It's a family
Maybe
business.
genetic.
Genetically, they are all doctors.
So
That's great.
I mean, at what point in your career or life did you really know or get to know about the cancer?
Before I had cancer, you mean?
When did you get to know about it? When did you discover that?
Started, like 2001. Yeah.
Was it while
was-
you're studying or is it?
No, when I was working. I was
Okay,
in my
so it was-
career.
okay.
Yeah, I was a dermatologist already in my career. And then I discovered it actually by accident that I feel there's something wrong in my body. And then
What was the symptom sensation you had?
nothing, just I'm feeling weird
Okay.
because I'm athletic and I'm making sport. I'm taking care of myself. But I know my body,
Right.
the chemistry of I feel that there is something wrong.
Okay.
And then I have like a double of consultations in
Okay.
here and outside also, and they told me nothing is wrong. But I just follow my thinking
Gut,
that there's
your gut
something.
instinct.
Yes,
Yes.
exactly. And then I asked the doctor to have a biopsy during taking the X-ray, the ultrasound,
Okay.
to make sure that to satisfy my feeling that I want to make sure that nothing is wrong with me.
Yeah.
And then the doctor told me, "You're crazy. There's nothing. Just be quiet." But because also I have family history,
Yeah.
my grandmother, and that's why I feel there is something not okay with me. And then that's why it was very early. Thank God it was very early when it discovered. And then they told me, they took the biopsy today. Next day, I have a phone call. I am the one who's running after the result. And then the doctor, I will never forget this moment. And then the doctor told me, "Sorry, doctor, I want just to tell you that you have breast cancer."
Breast cancer.
Oh my
Yeah.
God.
Yeah, I took the fact. I cannot lie and tell you I was very calm. And no, of course I have
It was
panic.
a shock to you.
Of course.
Even though you have had a feeling something was off.
Yes, it's still, I have panic, I have a shock. It took me like, 15 minutes. And then I'm thinking, am I going to die? My daughters,
Yeah,
these are the
yeah,
two things
yeah.
that
Yeah.
came to my mind. And then I just calm down and talk to my God. What's going to happen? Please, God, whatever is going to happen, I just want to be like, okay, with anything is going to happen. But I knew from that time that I'm going to struggle. I have a journey to go. And I was ready because always in my life, maybe in my social life or in my career, I have ups and downs always.
I'm sure.
Always. So
Part of life.
it doesn't take me,
True.
I don't have time to waste.
Yeah.
I will just stand up and then begin again. So I knew that I have a journey to go through.
So wise, though. That's extremely, extremely
Yeah.
wise. I mean, I don't think it's actually normal or common for people to be this wise. What was it that was driving you? Is it the daughters that were kind of like, kind of telling you that, listen, I have a path to go. I have to hustle and work hard on myself, or be in a positive mindset?
Yes, because I'm a single mother and I'm responsible for 2 daughters, and then I know that I have to do it myself.
Yeah.
You're
Yeah.
just hearing that, you're a champion. Single mother of 2.
No, definitely.
Cancer survivor, a
Thank God.
doctor, you know.
And she has 2 daughters, which one of
Yeah.
them is now a doctor. I mean, then
It
probably
does
that's
run in the family.
the second
It
one.
is in the DNA.
The second one is next. It's just that's honestly, I think, looking back at your life, that's definitely a lot to be proud of. And I'm sure your daughters and the whole family, I'm sure they're very, very, very proud of you.
Thank you. And maybe this journey, the cancer itself, makes something to my personality. It was a challenge for me
Yeah.
to be better.
Of course, yeah.
Yes, of course. It was a cause. Not everything bad in your life, it means that it's bad.
Right,
Like
right.
in our book, in our Quran, in Yusuf, Surah Yusuf, it's telling that later on you will know that there is a bright part of this.
Yeah.
There is a good part of it. Later on you will know it. But during this one, maybe you will have, but I don't have time to waste. I don't have time. I have to stand up and I have to begin and I have to go through my aims.
You have to step forward.
Yes.
It's like there's light at the end of the tunnel.
Absolutely.
Yes.
Always, but a lot of people are too blinded. Sometimes they honestly don't see it. But then you're seeing it very, very bright.
Yes.
The light at the end of the tunnel.
I love that.
You know,
Yeah. So you said you got into becoming a doctor because it's a family business, but why dermatology specifically?
It was a wish of my mother. I'm honest.
Okay.
It's not. I was going to be a gynecologist in the start.
Oh.
Yeah,
That's
and
a
then
huge different career path.
Yeah, and then this dermatology before it was not that
That
you are
big, huh?
seeing now.
Okay, yeah.
But she has a vision. I don't know why. She told me, please follow my.
Please.
Yes, please. And she was everything to me. That's why I just
Amazing.
follow her. But
Okay.
later on, yes, it's my favorite. I'm going
your
to work as if I'm doing something really I love.
That's amazing.
Yeah.
And what's the skin and laser consultant part? You also focus on that as well. As
I
a
like-
part of dermatology, I'm assuming.
Yeah, but I like to be different.
Okay.
A lot of dermatologists, but I want to be laser and I
Okay.
want to be surgical laser. Then I want to be innovative. So I'm innovating things new.
Amazing.
Yeah, after this cancer, I want to prove to myself I'm still there. I still have health. I still have power to give.
yeah.
I love that.
Yeah.
Does it build a mindset in you, like going through something this hard? Does it build a mindset of, I mean, nothing is impossible kind of thing?
Of course.
Yeah, I
Of
can see
course.
she's fearless.
Honestly.
You know?
Yes, and you have always an aim to reach, whatever your age. I studied every 3 years I have a master or a course to study. I have always an exam and a result. So one of them is anti-age. I don't believe on the age. I don't believe. I believe that you have something to do, you have aim. It doesn't finish to me.
Yeah.
There is another step always.
Yeah.
This is what I learned from my dad. Yeah.
That's a wise dad.
Yeah.
Yes.
What exactly? Can you elaborate on that lesson specifically?
What do you mean by
Well,
this?
that lesson specifically. I mean, it seems like it meant a lot to you, that advice from your dad.
Yes, of course, because he believed on me.
Yes.
And he was always telling me that I believe that you're going to do better. And
always,
when
yeah.
this happened to me, this is his support. He told me, Manal, after this, you will be more famous. You will be more successful. You will have new things. And this what happened already. Yes.
And that's who you are today.
Yeah.
Yes. Thank God.
It's the things that we go through in life that make us who we are at each moment, and you've been through a lot, and I think it helped shape the person that we're interviewing here today.
Yes, and then I believe that the wise person is paying for this experience every day. You have to go through difficult things and pay from yourself.
Yeah.
So you will get this wise mind and you will get this person that you are in now. Yes.
That's exactly. I read this recently that there's always a tax in everything we do in life.
Yes.
There's always a tax.
Right.
Sometimes it's time. Sometimes it's your health. It
But
really
in the
doesn't
end,
matter.
it deserves
I
what you reach. Yeah,
Yeah, I mean that depends on your goals and objectives, and
Yeah. True.
I don't know. But in terms of cancer, I feel like it just comes. I feel, but I mean, it's interesting how you were so confident that something was off, where the doctors were confidently
Yes.
telling you that nothing
I'm so
was wrong.
stubborn. I'm telling him he's a friend of my dad, and then he's telling him, "Your daughter is crazy.
Yeah.
Why she want to go through like a dark route?" I told my dad, "I feel there's something wrong.
Just a gut
I'm-
feeling.
Yeah, just
Yeah.
a feeling. I'm not well. There is something wrong in my body. I'm sure." And then it's just during the biopsy they discovered, and then it's very early. So
Wow,
good.
man.
Yeah.
How did the doctor feel?
He feel very bad because he's very famous and he's very successful.
I mean,
Oh.
And then he met me here in Kuwait in one of the conferences. He told me, "I'm sorry."
Oh.
Yeah, really. He told my dad also, "I'm sorry, but Manal has a feeling inside. I don't know what to tell." But thank God that it's very early. It's between stage 1 and 2. It's very, very early.
So
But,
it was a good thing that you listened to your gut feeling.
Yes, yes. Sometimes you
Now,
have
I
to.
mentioned how fearless you are. Going back to your childhood, what moments helped shape the fearlessness in you as you were growing up, maybe adolescent years, you know?
In the childhood
Throughout
stage,
your childhood, what shaped that fearlessness factor in you?
because you're
You're
someone that
following, yeah.
honestly very fearless in terms of that you don't mind jumping into anything at this point.
you know, especially the daughter, when she has a father who is covering all the sides of her, she feels that everything is easy.
Yeah.
So I feel like I'm protected. I have my mother, she's very kind. But for the girl, the support of the father is everything in life.
Interesting.
If she has this support, she will feel that she can make the impossible thing.
Possible.
Yeah, and she will see the father as a hero who is pointing to her, "Do this, do that, don't be afraid, I believe on you." So everything later on will be like shining in front of you, and you can see. My father was always telling me, "I can see, where are you now?"
Wow.
Yes, really. And the girl is, the father for her is, I believe he's everything.
He had a strong vision for you, and it
Yes,
came.
he
it
believes
came right.
so much. I'm the favorite in the family.
How many siblings do you have? How many siblings?
How many siblings
We
do
are
you have?
5.
5, and you're the favorite.
I'm
Are
the
you the
favorite.
youngest,
maybe
oldest,
Are you the
most
youngest?
child? What's
no,
your
no,
ranking?
no. I'm
The youngest is usually the
Yeah,
the-
yeah,
the
so I'm
favorite.
trying to find
No,
out.
I'm
Are
not the
you-
youngest. I have my brother is the youngest, but my mother and my father made me special. I don't know why, but I'm the favorite to him. This is what I
Are
believe.
you
Maybe
just the ranking? Are you the third child, second
the
child?
fourth.
Fourth.
The fourth.
Yeah,
Second to last.
maybe.
I'm the youngest. I am my parents' favorite. Yeah, definitely. In Arabic, مدلع,
The
you know?
youngest, the youngest.
But you're the
girl.
youngest daughter.
Yeah,
Maybe that's why.
yeah, maybe.
Yeah.
Maybe yes.
The special one.
Yeah.
And who's always telling yes, okay, and so I'm so touchy
It's
and
great
so
having
emotional
supporting
with
parents,
them.
yeah.
That's why maybe yes.
Well, we'll continue this conversation right after we take this little break.
Back from the break to continue this beautiful conversation. All right, so I have a question about where you're actually born. Right, so the producer told us that you're born in Failaka Island,
Yes.
which, as far as I'm aware, is I mean, I've never been, to be honest.
You've
She
never been to
I've actually
Failaka?
never been to Failaka. I was
Never been to
I was
Failaka?
born and raised in Kuwait, but I've never been to Failaka. I don't think my dad has either.
You have
So tell us
to.
more about that story.
The best place in the whole world.
What was it like being born there, growing up in Failaka? Because the Failaka I know today is not the Failaka you grew up in, right?
Yes, we just born there and then we left after.
How long
But
did you spend?
My parents told me like 4 years
Oh,
after
wow.
I born, and then they moved.
What stories have they told you about Failaka?
A lot of amazing stories,
Hmm.
and then I love it. This is the best place in the whole world because I born there. And actually, one of my professors in Greece, he's telling me, "You are Greece. You're not Kuwait. You're
Because
not
you-
Egyptian." Because Alexander the Great is the one who discovered Failaka, and
That's actually
or
really
Fallujah.
shocking to
Is
me.
that a true fact? Really?
Apparently-
As
It
well
is.
as Alexandria, and I lived in
Interesting.
Alexandria, so yeah. I'm
How
mixed
often
now.
do you visit Failaka these days?
I didn't. I never went there. My daughters only went through trips to the school, but I never.
So
but
ever
I
since
wish
you were
to.
born there and left, you haven't gone back?
No, no, and
The best place in the world, and it's a great
And I'm
place. Why don't
proud,
you
yeah.
visit? Are you like
have
motion
to.
sickness or something?
But I have to go there, I know.
You need
Yeah.
to. You need to.
But it's also apparently it's very rare to meet people that are born in Failaka,
yeah.
right?
Yeah, and I heard that they are making it now very nice and
It is a
yeah,
tourist spot
yeah.
now. It is.
yeah, hopefully. Yeah.
Shall we go back to the topic that we was speaking about earlier, which is kind of like the cancer journey.
Yeah.
So I think as part of that journey, obviously you go through. It's a very very hard journey. It requires a lot of. I'll say I have to be in a specific mental state to be able to fight it. Essentially, what was your support system along the way? Who was giving you the support and along the way? Or how did you? Was it you alone, or did you have people with you?
Actually, the actual support after this journey, I can tell you, first it's God. Second, it's you. You yourself is the first support, okay? And then the people around you. But believe me, not all the people will be supportive. It will not be like a romantic movie, no. Some people will quit, and
Of course.
thank God that they are very clear to tell, we want to quit, no problem, but at least they announce that they will quit. But most of them are very good and supportive, especially my family and my daughters, my brothers, my sister, my father.
Yeah.
All of them were, my friends, of course, supportive, very supportive for me.
And
The first support was me. Sorry.
No, it's okay. I
it's-
was actually just gonna ask about the patients in general, not just you. I mean, general patients, and let's say Kuwait. Are they having the support that they need? Do you think, in your
I'm
opinion?
actually treated in Kuwait.
Okay.
Yes,
All
yes. I found the best medical support here because my brother is in critical medicine. He wanted me to be in Paris, and we already talked to many doctors there. And then we found the protocol is the same. They told us just be there because this hospital is the best. It's the same program. So
Yeah.
stay where you are. So that's why I stayed there, and I took my treatment here. And then, but I just want to advise to make the psychiatry doctors all along with the patient.
Yeah.
But the chemotherapy is very good.
Okay.
The surgical part is okay. The radiology is okay. The nursing system and the doctors are amazing. Supportive.
But I've heard from many people that chemotherapy can be a bit, damaging in a way, or it causes other symptoms to flare up. Did
A lot of side effects
A
kind
lot
of
of
thing.
side effects.
Yeah,
Yeah,
yeah.
So, did you experience that?
I experienced that along with that my part of the body is gone together. During the journey, it's painful.
Yeah.
But after this, I survived from chemotherapy.
Right.
This is the weapon they use, but it has some side effects. Yeah,
Right.
Of course.
it affects me. Yes, the disease itself has a psychic
Yeah.
side effect. The chemotherapy has a psychic side effect. The female to lose part of her body
Yeah.
has a psychic effect. That's why she will be super hyper fragile. So she needs a super support, a
Right.
psychic support and emotional from the surrounding people.
The
of
way you
course.
put it is like super hyper fragile. That sounds like definitely at that point you need
It's a
someone.
very challenging.
It's a super challenging part of your life, or area of your life, and surely you need a lot of support system.
Because the shape is changing.
100%.
Everything. So
100%.
it seems that it also didn't take a lot of time from me. I know that I changed.
Yeah.
I know that I don't have hair, I don't have eyebrows, I don't have eyelashes. My body was very skinny, and then I am very pale. It's okay. It took me time, but I have to struggle. And then the people, the doctors here, they're amazing.
That's
Really,
good.
they are
That's,
amazing.
It's good to
That's-
hear
that's
that we
good to
have
know,
that. in
honestly.
Yes,
Kuwait.
even the
Very good.
technicians in the radiology. Even I cannot forget any of them.
And the
This-
awareness for October, is it right? Every year in
Yes.
Kuwait, they advocate for screening and all that.
Yes.
So there's amazing to have in the country.
Absolutely. Screening for women and
Yeah.
men, essentially, not just
Absolutely.
one specific gender.
Yeah.
How did you? How does it feel? How did it feel for you after you kind of like go over it? Like, do you remember the day that you just heard the news that you know what?
Yes,
it's
of course. I was in my hospital, and then I'm just running after the result. I'm just making a lot of calls, and then finally the doctor answered, It was the early morning, and then she told me, sorry, doctor, like this, and then I have time to have this shock, and then I don't know, as the same thing that I feel that I have something wrong, I feel the same thing that I'm going to be okay.
Yeah.
Okay.
It has inside me that I'm going through a
Right.
way,
Absolutely.
but I'm going to be okay. But not that easy.
Yeah.
But I just have a path that I ask my brother, of course, because he's a critical medicine and he knows more than me. He's so supportive. He told me it's not that easy. But you're going to take a strong antibiotic. You're going to take harsh things to do. But I believe that you're going to...
You will survive
yes,
at the end.
Yes, you will reach.
And overcome.
Yes.
And you have. And that's a beautiful story
Yeah.
that you're sharing with us here
Of
today.
course.
I want to shift to you being a dermatologist.
Yes.
And you mentioned that you even advanced the laser technology in surgeries. And could you elaborate on that? What have you done in that term? Like, what kind of procedures have you come up with? Or, I don't know, you said you advanced it.
You mean in my career?
Yes.
Yeah, after this journey, after this cancer came, and then I have some difficulties in my life, I want to believe more in myself. So I want to be non-traditional doctor.
Okay.
So I traveled a lot to make a lot of researches, a lot of studies, a lot of courses, a lot of masters. Every 3 years, I have something to study
Wow.
and to prove myself in.
Wow.
So first, I went through lasers, and then I'm through. It will have like not more than 1 year to have the patency of my own
Okay.
laser machine, and as well as a mesotherapy or a solution to inject. I have my own as well
Okay.
to innovate in Spain.
Nice.
And then my line of course, creams and these things. Every time I want to make something new and something different.
So you have your own products.
It's going to be less than 1 year, all of this will finish, because it needs papers, patency, and my daughters are helping.
So you're going to
me
have a
on this.
dermatological product line.
Yes.
That's
Do
amazing.
you own a patent on these products?
My daughter is helping me because she's a pharmacist, and then another one is a medical doctor. Both of them are helping me to make this patency. I'm
Nice.
studying, and
Wow.
and then they
Wow.
are helping me.
They're
to
not just
publish all of
doctors,
this.
but they're like creating actual medicine for you.
You're like
We are a
business
team.
people. So you said you something about Spain. You said about creating your own technology.
Yeah, laser machines.
In Spain, I'm making mesotherapy. It's a solution to make lifting without filler, because I'm a dermatologist, but I'm not friendly with the filler. And my colleagues, my professors love filler. Filler, people has to believe that there is an alternative. They have another
Okay.
choice. I'm not telling that filler is bad.
What is the
So you're
alternative?
trying to provide a different approach.
I spent like 10 years discovering a type of vitamin and peptides down the skin
Yeah.
to make lifting without any filling effect and without changing your how you look like.
Interesting.
Yes, it's just to enhance your skin
Yeah.
to be younger, but it took me to study like 300 peptides, like 1,000 vitamin,
Oh my
Wow.
god.
and customize to every patient what to do. And the interesting thing is that I'm beginning now to learn the language, so the Spanish language, so
Nice.
I can talk with them freely. Yes.
That's impressive. So then, are they like creams for acne, or like what specifically are you gonna make?
Specifically, I'm dealing with the lotions of the hair,
Okay.
anti-hair loss,
Anti-hair
away
loss.
from minoxidil and the usual things,
Okay.
anti-age, and
Anti-age.
scar creams, especially
Scar
the scars. I'm concentrating on the scars,
Okay.
and the collagen creams as well.
When is it coming out to the market then?
It is going. This question is asked to my daughters. They are they are.
The
managing
daughters are
this.
going to be asked the question.
Is it a year? Approximately a year.
Okay.
Okay. That's her daughter behind the camera, a pharmacist
Yeah.
in her own way. That's great, and within a year we're gonna have products by you,
Hopefully,
which is a huge accomplishment, I would say.
Shall we just connecting both now? I mean, connecting both what you're doing for dermatology and the cancer. Did you feel like it has built something in you that you really want to give something back to the world?
Yes, of course. Very important thing. Your body is not yours. Sorry. Your body is a gift from God. So don't deal with your body harsh. Don't tell that, and don't tell bad words about your parts of the body, because the organ has cells and has a psychiatry. For example, the patient is coming to me, I hate my hair, I hate my nose,
Yeah.
I don't like my leg. I'm telling them, love your body first and then come to me and make it better.
Yeah.
Love it first. So it's not yours. Imagine that it's your birthday, I give you a gift, and then you will tell me, I don't like your gift. It's not nice. It's not good. So you have to deal with your body that it's a gift from God, and you don't change how you look like.
Yeah.
Why I'm telling this? Because during my journey to cancer, I actually really met people that has a test of cancer of the part that they don't like. You know what I mean?
Yeah.
What do you mean exactly? Can you actually elaborate on that point?
I don't like my nose. And then she has a disease in her nose in the end. This is the nose you don't like. I hate my tummy. And then she has something in the liver.
Yeah.
I don't like my knees. And then she has rheumatoid. Why? Don't tell bad words about your body.
Because your
Love
body listens.
He feels
Yeah.
and he's getting angry.
Of course.
And it's not yours in the end. You
course.
have to take care of your body in a way to
Yeah.
return it back to God in a better way.
It's an interesting way of looking at it.
Yeah, I mean, you're kind of talking to your brain again, and your brain talks to your body. And if you're talking, if you're
Right.
saying that you don't like yourself, no wonder your body is just gonna prove that, you know.
True. I have an interesting question.
Yeah.
So I'm going to give you a few words and you tell me what they mean to you or how you define them. Okay? Being resilient.
I mean to struggle. Huh?
Struggle.
Yeah, it's me. This is me.
It's true.
Yeah, it equals me.
Giving up.
Not in my dictionary at all.
Good. I love that. I love
That's
that.
actually very
I love
nice.
it. I love it.
Yeah.
Chemotherapy.
It's the best thing happened in my life because this is one of the weapons. It's a strong antibiotic that treated me. Plus, it's not only for cancer. Some of the rheumatoid people are taking chemotherapy. So it's not a ghost. It's not something bad.
Right.
It is making something good, but it has some
Is
side
there a way
effects.
to diminish the side effects of chemotherapy?
Yes, I think some of the researchers are telling that it's, especially for the females, it's
Yeah.
annoying.
Yeah.
This is the first thing they will ask, is my hair going to fall?
Yeah.
But to be honest, when it regrow, it's
Yeah.
better.
Oh,
The skin is better, the eyebrows are better, the hair is better.
that's good to hear.
The
That's
health is
fair.
better.
That's fair.
As if it
Well, thank
makes
you for that,
detox.
honestly.
I
Right,
don't know,
right.
but this is how I'm living now
Yeah.
because this is one of the weapons. This is the most powerful weapon that
Right.
the doctor uses.
Lovely.
Yes, of course.
And this is connected to chemotherapy. What does surviving cancer mean to you?
It's a club that I am so proud to be belonging to.
Interesting.
Yes, I'm so proud to be
You wouldn't
part
have
of
wished that part of your life gone. You want that part of your life.
Yes, of
Because it
course.
shaped the person.
If my life, we learn from our kids.
Yeah.
For your kind of. My daughter, my youngest daughter, told me, if your life is a puzzle, don't remove any part. Even if this part is a cancer, is losing somebody, because this puzzle is the one that make who you are now.
Right.
So
Nice.
especially the cancer, no, it is okay. It's fine. Because this is what makes me struggle, what makes me studying always, proving to myself that I'm here,
You're here.
I'm living, I'm okay. That's it.
That's really wise from the daughter.
Yeah.
I have to say that actually. Nice.
Well, I feel like we're reaching the end of
We
the
are,
show,
yeah, we
so
are.
an advice would be great from you, doctor, to maybe cancer patients, inspire them.
I will inspire the cancer patients and I will inspire the women, especially, to love your body, believe on yourself, and also to, if you have a problem, don't let the problem to take more than 1 hour. Discuss
If you
with
have
yourself.
a problem, don't let it. Okay.
1 hour.
1 hour.
Full stop.
Full stop.
Stand up. Go again.
Go ahead.
That's it.
Okay.
Don't let the chemistry of your mind and of your body to be affected.
yeah.
And also, when you treat somebody, treat the body in front of you with the best version of this person. The other versions he has, maybe it doesn't belong to you, don't take it, okay?
You're good.
And also to look at your page, look at your book. Mind your own business. Don't compare yourself to others.
I love that one.
Don't mind that what others are thinking about me. Can you believe that I was bullied already during my
As a cancer patient?
As a cancer patient,
Bullied?
from my competitors in work and from some of the people around me, and
Shame on you guys.
Honestly,
I ask myself, what did I do? That's why everybody mind your own business.
Right.
That's it.
Right.
And then no time to be sorry for yourself, and do not be ashamed. I'm telling every woman, please
Don't be ashamed.
Don't be shy from what happened. Just make it a struggle, and surround yourself with the people who give you power.
I think that's the most important thing, surrounding
Yes.
yourself with people,
Yes, and surround yourself with the people who give you positive energy,
Yeah.
not to drain your energy.
Right.
Yeah.
No.
Absolutely.
Yes, and then believe on yourself, and please try to be happy as much as you can.
yeah.
Well, doctor, beautiful words.
Honestly, thank
One
you
of the
so
best
much for that.
advices I've heard on the show.
Thank you so much.
Thank you for your time today.
And I thank
Been
you
a pleasure.
guys so
Honestly,
much.
thank you, thank you,
it's
thank
our- it's
you.
our pleasure.
Beautiful episode.
Well, ladies and gentlemen, we'll be back for the wrap up. Well, you weren't kidding when you said
Yep.
ultra special. You know?
Absolutely, absolutely, man.
So many lessons I learned from her just
Yep.
listening to her story. You know, I love that she gave us the time today and came on here to share her story, the
Yeah.
struggles she was been through. You know, even getting bullied. I said it
Unreal, though.
before, and I'll
Actually,
say it, I'll say
that's
it again.
unreal.
Shame on you, whoever bullied the doctor.
Yeah, yeah, yeah.
What kind of person
Yeah, yeah.
does that? you know?
Absolutely, yeah. No, I think it's an episode to remember. A lot to take from her. She's someone I don't. It's rare to find such optimism.
She's like a hidden gem.
Yeah, yeah. Honestly, I mean, very optimistic about life.
Yes.
And I think
Even at the lowest of lows in life,
Yeah.
she was optimistic.
Absolutely.
Like you said, seeing the light at the end of the tunnel.
yeah, 100%,
You know?
100%.
And I love her perseverance. She's resilient. She's a fighter.
She really is.
And
By all means, yeah, she really is.
Fearless. I'll just call her fearless. Thank you
All
for
right.
your time, Dr. Manal. It was a special episode.
Thank you so much.
And thank you for tuning in here to The Untold on KTV2. Tune in next time for a brand new guest and more stories right here on The Untold.